A local emergency room doctor says about 80% of the people who come down with COVID-19 will make it through just fine.
Now, while there's no medication, about 20% may need to go see a doctor. Q2's David J. talked with a St. Vincent emergency doctor.
A temperature of 101.5 degrees is one possible symptom of COVID-19.
The COVID virus, what we're seeing is it attacks the lower respiratory system. You do get a cough, and then as it gets more severe, people start experiencing shortness of breath. Fever is very common. Muscle aches are another thing that have been reported with some frequency. But that's kind of the gamut of symptoms that we see with this new coronavirus.
Dr. Michael Bush is the St. Vincent Healthcare Chief Medical Officer and has been an emergency doctor for 30 years.
The 2009 swine flu, the Ebola, concerns that we had, but this is the first worldwide pandemic in 40 years of treating patients.
So if you do have the symptoms, Dr. Bush has some recommendations on whether you should come to the emergency room or do something else.
If you are feeling like you are very sick, high fever, feeling short of breath, then those would be patients that potentially might need the resources of the hospital. For patients that don't have those type of symptoms but are worried, we would recommend contacting your primary care doctor.
Once in the hospital, there is a procedure for determining what the patient has.
Once you show up in the emergency department, we would be putting a mask on you, limiting contact. We'd be testing for influenza because that's far more common even today than is the COVID virus. We'd be looking for other respiratory problems and then considering testing for the COVID virus.
Dr. Bush expects that a vaccine or antiviral medication is 18 months away.
The treatment for this virus is symptomatic treatment, so it's supportive treatment. We're providing oxygen if you need oxygen, helping maintain fluid status and those type of things.
And St. Vincent has some restrictions at the hospital to limit the spread of COVID-19.
We're asking people under the age of 18 not to come to the hospital. We're asking people that have any upper respiratory symptoms, cough, cold, fever, any illness, not to visit the hospital. Bump arms, wash your hands, cover your cough, stay 6 feet away, and make sure that if you're going to a group function, that it's something you really should be going to.
In Billings, David J., MTN News.
All right, thanks so much, David.
Now, Dr. Bush expects COVID-19 to show up here in Montana in a few days. He says it will likely be something like what has happened in nearby states such as Wyoming, where someone got the virus while traveling.